Hello and welcome to this week's Pandemic Podcast for Educators. My name's Gawain.
I'm Karam.
And I'm Merike.
Please do subscribe if you haven't already using the button below. This week we're going to be talking about the latest COVID data, the latest infection rates, and we're also going to be talking about an announcement the government's made which has got some people really quite angry. We've got with us today two guests. We're really pleased to welcome Infectious Disease Epidemiologist Dr Claire Risley and Supply Teacher Organiser Shelagh Kavanagh. You're both very welcome. Really glad you could join us today. So starting point, we've heard news this week that education is now in the top 3 places where you can get infected with COVID. Tell us a bit more about this. Merike, what's the story?
Yeah, so Sky News had put a thing up yesterday or the day before, essentially saying that most likely places people have been prior to them testing positive for COVID. Supermarkets came out on top, followed by secondary schools, closely followed by primary schools. However, if you then continue to go down the list and add up all of the other places that can be classed as educational establishments, rather than having them split up, it adds up to 28.4% for education compared to 18.3% for supermarkets. And as they haven't split supermarkets down into the likes of Tesco, Aldi, Waitrose, why on earth have they split education up? Unless it's to, back up government rhetoric that actually, shut up, get to school, get on with it. It's all fine.
So effectively, we're now talking about education being the top place where you can get infection. Karam, what's this based on? What's the data behind this story?
Well, looking at the fine print of the data, it does appear that it's not fully based on contact tracing. They've just been looking at where people have frequented before testing positive. So I would assume that the 18% figure of supermarkets is most likely to be inflated, because how often do people visit a supermarket? Normally at least once a week or so. So I'd find it quite difficult to believe that 18%. I think Claire had something else about the data as well regarding this.
Yeah, in the article that they published on the Sky website, they're quoting the Public Health England data, and they've got the graph that shows what the headline figure is about. But right under that, they've got the number of contacts by exposure and activity. And if you look on that, then of course most of the actual contacts people make are in their own household. And a significant number of contacts are within the education setting. And it's only if you look at 1, 2, 3, 4, about the 10th on the list is shops. When you go into a shop, you're not making contact with people. So it's totally disingenuous to use that shopping is quoted as a number one activity, when as you've said, then everybody goes shopping.
So the message here seems to be: don't be afraid to go out and get your daily, weekly essentials. Probably weekly. We're supposed to be trying to minimise contact and shopping visits. So don't be afraid to get your weekly essentials. But that we still have a real issue in education settings, and we know the NEU called for schools and colleges to have a circuit break, a 2-week circuit break, including the half term. The government ignored that. There was no lockdown at all, and then immediately said we had to go into lockdown. But again, they didn't include schools and colleges. We called for them to be included in the lockdown. That's not been done. And now we've got real issues. And obviously that impacts on the entire community, doesn't it? If the virus is spreading in schools, that's then going back into homes, it's going into the shops, it's going to wherever people go once they've caught it. So it is about the whole community. But it has a particular impact on supply educators, doesn't it, Shelagh? If there are high rates in schools and colleges, then it affects their ability to go and do their job.
We haven't got any solid figures on this, but the evidence is quite clear that schools have had to spend a great deal of money on making themselves as COVID as COVID proof as possible. And this has meant hiring more cleaners more frequently, for which they've had no supplementary budget from the government. Plus, if you just think of a class of 30 children who've got to wash their hands when they come in, before they go to break, when they come back from break, if they when they go to lunch, when they come back from lunch, and before they go home, the children will be washing their hands at least 6 times a day. That's 6 times 30 plus the number of paper towels and soap that they use, when it would have been once or twice. So the actual bill for paper towels and soap and all that has gone up by a factor of about 5 in most schools. So the money's just not there for hiring substitute teachers. Now, we do have numbers of schools that are having to close bubbles because a child's family has got a positive diagnosis, or a teacher themselves has a positive diagnosis, and most schools are playing it safe. So if a teacher is living in contact with someone who's got positive diagnosis, they've got to isolate for a few days. So someone's got to cover their class while they're isolating. And most schools are doing this internally by using a teaching assistant and not ringing up for a supply teacher. Also, a lot of supply teachers are fighting shy of going into schools where there has been a positive diagnosis.
Which you can understand, yeah.
So because they won't be able to go anywhere else, they'll have to then isolate subsequent to that. And so people whose main income is supply teaching have been massively hard hit by this, because everybody's got to play safe. Schools don't want to be the vector of infection, and supply teachers are not allowed to be carrying it from school to school. So many of them have got no income whatsoever.
And this is a
huge...
to
the point, sorry.
No, after you, Merike, go on.
If it gets to the point where somebody's in on supply and then they have to isolate, so if that was me as a permanent member of staff for Stockton Borough Council, it's amalgamating words there, something fun. I would still get paid. What about a supply teacher or TA working through an agency? If they were told that they had to isolate, would they be losing income as a result?
Probably yes, because the agencies are not obliged, because it's not a contract of employment. So you can get statutory sick pay as long as you've done all the correct paperwork and you have previously working for that agency and satisfy all the criteria for statutory sick pay. I've got a whole bunch of information on it, but to qualify for statutory sick pay, you need to have done some work for your employer. You need to be averaging £120 a week. You need to have been ill or shielding for at least 4 days in a row, and then you can apply for eligibility.
So this is quite a lot of criteria to meet. Whereas, as Merike says, if she or I were off because we had to isolate, our agreement with our employers is we'd be off on full pay. We don't even move to sick pay. So I mean, an awful impact on supply educators, but also there's this massive underutilized resource. We're talking about, one of the ways of breaking the infection is to reduce class sizes and allow social distancing. We should be making more use than ever of the skills and abilities of supply educators in order to make this possible, but it's not able to happen. And there's part of me that can't help thinking, if what we had was clear local supply pools, you would be able to direct people so they wouldn't be moving school to school. They'd be filling the gaps as necessary, but on a planned basis locally with no fear of spreading infection. So to me, there seem really obvious answers, but we don't have them because of the breakdown of local authority supply pools.
Oh, sorry. I was just going to say on the issues of the schools not having the budgets. A lot of the time now they're asking support staff to cover lessons instead. But that means you're asking some of your lowest paid workers to work beyond their contract, to take on additional responsibility without remuneration. And that's also meaning that we're removing TAs away from the SEND and vulnerable students they should be supported. So those students that the government said that they were so concerned about aren't going to get the support that they need because they're covering for supply teachers that the government's not willing to pay for. So there's just a knock-on consequence all the way down to the most vulnerable students.
No, it is awful, and of course, it exposes lots of weaknesses in the system, doesn't it? But ultimately, the first step has to be to beat this virus. Now, we've called repeatedly for schools and colleges to be included in the lockdown for the half-term circuit breaker. What is the impact of schools and colleges being closed on the virus, Claire? Can you tell us a bit more about this? Why is it so important?
Well, I mean, yes, schools are a major location for transmission. So earlier in the year, there was a study published in a good peer-reviewed journal, the Journal of the American Medical Association, and they were looking at American schools, and what they found was that school closure was associated with a 62% reduction in the incidence, i.e. the number of new cases. So that's not even the number of cases that exist, it's the number of new cases were down by 62% over 1 week. And that is of course a massive reduction just by that one intervention of closing schools. And I've been doing some modelling of this, and if you put in that kind of reduction in risk, it really affects the dynamics. So I'll just quickly share my screen here, and what you can see is here we've got the first wave in the UK and the second wave, and bearing in mind this is just a model, it's not these aren't the data, this is how, when you put in all the parameters for the country and the epidemic, what's the predictions that the model makes. But I mean, you can really see the impact. Every time there's a school holiday, there's either a big decrease in the increase in cases or a literal decrease in cases, depending on depending on what the epidemic is doing and its natural dynamics at the time.
So just for those listening, what you can see there is this huge sort of first wave. You then see the drop as lockdown measures were applied, schools, colleges were closed. You see that right through the summer, and then it starts to climb again. But the point at which that climb breaks, the point it plateaus out a little bit, is over the period of half term. But as soon as we come back after half term, then it begins to climb again. So I mean, this is really serious, isn't it? None of us went into education because we wanted to be at home, remote teaching, trying to support our students from a distance. But we've got to take this seriously, haven't we, if we're going to protect communities? What are people's thoughts?
I think it's easier said than done in certain year groups. So I imagine doing remote learning in a secondary is a lot easier than doing remote learning in a primary. And then if you split that down even further, doing remote learning in Key Stage 2 is an awful lot easier than attempting to do so in early years, where the children in early years need personal, social and emotional development. It's one of the prime areas. It's very, very difficult to do that if you don't have any other children around you in order to develop those personal, emotional, social skills.
Oh, and we've had a lot of talk from government and others about the idea of blended learning, but very little practical advice on what it means at different age groups, very little sharing of best practice, very little experience. There must be creative ways that we can do this, not to totally break contact, but minimize it, at least make schools and colleges safer. Yeah,
and I think part of the reason that I don't think we've been getting that guidance, particularly for the younger age groups, is this whole rhetoric around, well, they don't spread it at that age group. But actually, if I think about the school closures that have been in my own local area, quite a number of them have been in early years classes, or at least Key Stage 1. And I think they're forgetting something about schools, and that's there's not just children in that building. There are adults in that building, and there are adults coming to and from that building at various points during the day, mainly drop off and pick up times. For my own early years class, it's occasionally I do have to actually like carry a child inside If they're having a particularly upset time, they might have had a booster injections, because, you know, normal life continues even though we're in a plague. So the child might need a hug. Therefore, I'm in even closer contact with the parent than I would be normally. Trying to socially distance within an early years setting is nigh on impossible. Yeah. Even if you are able to work slightly away, or you get the children to stay slightly further away from you, although how that would be possible without being in one of those giant Zorb balls, I have no idea. I've still got other members of staff around me, there's still support staff, and we do occasionally need to work together if there's been a particularly interesting incident that we have to deal with. So I think it's an oversight as to how things can spread in primary.
I think the key is it needs to be taken seriously, doesn't it? It needs intervention at all levels of education in order to make it as safe as possible, and where necessary. You know, we're not calling for indefinite closure, but actually the idea of a circuit breaker, short closures now, to minimise the massive disruption that's happening at the moment. You know, I'm talking to a colleague the other day who works in a secondary school in London, and they were saying, you know, they've got 3 entire year groups out at the moment. They had different year groups out several weeks ago. It's become completely unmanageable, and yet the government's planning on continuing with exams and all the rest of it, as if none of this was happening. And we're told Ofsted will be back in January, spreading the virus school to school whilst bringing fear and discontent wherever they go. Plenty to look forward to. Karam, your thoughts?
It's quite interesting, some of the headlines we've seen recently. So in particular, Hull, where the public health officials are calling for the switch to blended learning and mainly only having key workers in, as a measure to protect their hospitals. And then there's also the Academy Trust, which has just declared that it's going to be shutting early. It's going to be shutting all of its schools extra week early to ensure that all of the families have the 2-week isolation period before Christmas Day, so that there's going to be no pupils being isolated in that final week of school, and then not being able to be with their families.
Yeah.
Which I think is a really good move.
Or indeed seeing vulnerable elderly relatives and then something awful happening. You know, I mean, that's the real risk there, isn't it?
Yeah, we were talking about this within a group of school leaders the other day, actually, funnily enough, and they were saying the same thing, because not only is there all of the aspect of you don't want pupils having to be isolated in XYZ and the stuff that you've just mentioned, Gawain, but as a school leader, they're not wanting to spend their Christmas break having to contact public health and organise deep cleaning.
I mean, it wouldn't surprise me if someone at Westminster is able to count backwards from 25 and work out that if you shut schools on the 11th of December, you'd have 14 clear days, which is a Friday, by the way. 14 clear days, it's my birthday, that's why I know. 14 clear days to run up to Christmas for everybody to have the appropriate isolating period. It wouldn't surprise me if they say, oh, we've had a great idea. So watch this space. Well, seriously.
I mean, I'll be honest, I'm really, really torn. I know that every minute I get with my class at the moment is precious. You know, having gone through lockdown, you know, we had a number of them in. I was in most days during the national lockdown, most of my normal working days, and we had a number of the children in, but some we didn't see. And actually every minute with them is precious, but I can't put that experience before people's lives, and I think that's the really difficult thing, isn't it? We have to beat this virus. So in aid of all of this, in aid of all these people going to these extreme lengths to try and beat this virus, another government proposal was leaked this week, which I think is going to really inspire us all to continue putting our lives on the line, to continue fighting that virus and keeping our communities safe. They've decided to award us all with a pay freeze. What is a real terms pay cut? A real terms pay cut. So, go on, what's your immediate reaction to that? Pay cuts for public sector workers?
It's a kick in the teeth, isn't it? It's a complete and utter. We've been neglected throughout this crisis. We've been provided with no help, no support, inadequate guidance, and all we seem to get is headlines in papers and things like that attacking the profession and now we're going to get a pay cut as well.
Yeah, I had someone say to me yesterday, oh, well, they need to be able to pay for all of the furloughed workers somehow. I went, through my wages, when I've worked throughout the pandemic. We had from March until July with no break.
But also this isn't a concrete understanding of how the economy works. You don't just take it from one place to put to another. You know, the fact is actually what government should be doing is focusing on supporting those who've lost their jobs, who've lost their livelihoods, have nowhere to go, instead of awarding these ridiculous contracts to their friends who can't deliver on anything, multi-billion-pound contracts for this, that and the other, all of which falls and collapses while some people have no job, no livelihood, no income coming in, and others are now being told they'll be given a pay cut so the government can carry on paying its mates. I mean, Sheila, the impact on supply educators, if they're already at the shop, and what would be the impact of a pay cut on them?
Well, in terms of when they do eventually get back to work, it'll be zero impact whatsoever, because most supply teachers are getting, I mean, some towns 80%, but nationally up to 75%, with one or two exceptions in Northern Ireland and on the Isle of Man, are hired through private commercial recruitment agencies. Then they are not employed by the local authority, they are not employed by schools. And it's a sector of education that is completely unregulated, privatized sector, where the nationally negotiated pay scales for teachers don't apply. And being an agency worker puts you in the most vulnerable bracket of workers altogether. It is casual work. You haven't got a job per se. You're just a precarious jobbing gig economy worker, which is at a time like this an extremely vulnerable position to be in. So, you know, whether the government makes cuts or not, that rises or cuts were never reflected in the majority of supply teachers' wages. Into that bracket, we've also got to add all the home tutors and other sectors of the education system that were outsourced. So quite a lot of people who do, or who would be doing, hospital education and educating children who've been excluded from schools, tutoring them, they're also not working because they, if they can't do it remotely, for, you know, children who've been excluded from school for medical reasons, or who can't get a special school place, or who have got social and emotional problems that mean they can't attend school at the moment, they would by law have to be allocated a tutor. And that's often those tutors are also sourced through agencies, again paid at all kinds of random, whatever the agency fancies paying them, rates. Those people are all again missing work. Yeah, because of GDPR, they can't just phone the students up and give them a lesson online. Yeah.
So we're effectively talking here about a system of privatization which has left these workers totally vulnerable, unable to access the rate for the job, and then takes means that some of our most at risk, some of our most disadvantaged students are the ones ultimately that lose out, which is what we hear again and again. And so we need real change for supply teachers, don't we? We need an alternative to agencies.
And I can't see it being an easy task anywhere to try and negotiate a pay rise with an agency if the rest of the education workers have a pay freeze, because that any leverage that would have been theirs being reduced even further. Also, on the pay freeze thing, didn't they have it in their manifesto or something about raising the starting wage for newly qualified teachers to something like £30,000? How are they going to do that if they're freezing pay for 3 years? Are they just going to break their manifesto pledge?
Another broken promise?
Yeah. Well, I think some of the rationale for that is I mean, not many people are saying this, but it is sayable that, well, you should be grateful you've got a job now if you're a public sector worker. So I think, you know, anybody who works in the public sector, whether with the police, the criminal justice system, probation officers, all those kind of people, they're going to be talking about social workers are all going to be hearing the same story. Well, you should be grateful you've got a job.
But we heard this. We heard this with pensions, didn't we? It's the same arguments made again and again. But of course, what happens is as soon as they've come for public sector pay and pay rates go down in the public sector, they immediately then say, well, the private sector is paying too much by comparison. Look, there's public sector restraints, so we need to cut back in the private sector. Ultimately, it impacts on everyone's pay. And actually, I feel really strongly what the government should be focusing on here are those who've lost their jobs, those who've lost their livelihoods, those who need a source of income. And when we get out of this lockdown and there's no more bars on evictions, those who are likely to lose their homes, focusing on those issues rather than on giving public sector workers a kicking because we've still got a job and because we're out there trying to keep communities safe.
Mm. Yeah, I mean, I'd speak sort of on behalf of agency workers all over the place, because obviously agencies don't just operate in education. So there's lots of people, certainly in social care, nearly all women, and nearly all of these women who go to elderly people's homes to make sure that they are fed and clean and dressed and looked after. These ladies are also on appallingly low wages. Their job is a complete rip-off. They don't get travel expenses. They'll be driving all around town all day, working very antisocial hours, very highly exposed to COVID. These people's wages are also likely to get frozen, which again is dreadfully unfair. Anybody who's got an elderly relative will know the sort of responsibility and the expectation of home carers. Then there's all those people in the hospitality industry, certainly in the seasonal hospitality industry. There hasn't been any this year. A lot of those people would have come over from Eastern Europe to do bed making in hotels and all those kind of jobs that have got to be done to keep the hospitality industry going. They're all out of work. A lot of those were not eligible for furlough at all. There's anecdotal stories of people in that position now living on the streets. Being put up in the very hotel where they used to make the bed a few weeks ago. There's an extreme irony of it.
Indeed, and of course the temporary nature of that, and I think there's a real danger of massive homelessness crisis at the end of this when we come out of lockdown. But Shelagh, one question, and then I've got a final question for everyone. Just are there alternatives to agencies in education or elsewhere? What can we do?
Yeah, this is my specialist subject, and yes, there are, and this has been something that the National Education Union has been looking at. A document was published a couple of weeks ago, the Alternatives to Agencies Toolkit, which is a bargaining toolkit for local union branches and districts to put to schools, local authorities, multi-academy trusts and dioceses to look at bringing the provision of temporary teachers back in-house and actually hiring people on a casual basis, on a effectively a 0 hours contract, where they could be deployed, or for schools to actually hire a floating teacher, which is effectively what I do. And so there are material for anybody who is in the National Education Union, or it's on the website. Anyone can actually get on to our website. We know it's a good one because as soon as the document was published, there was a furious response from the Recruitment and Employment Confederation, saying that this is never going to work, that it won't guarantee any of the things that they guarantee, that there won't be compliance with the law, the teachers won't be DBS checked, which is not true, and it all falls completely within the parameters of what we've laid out as a very workable, practical, you could do it today plan. This one really is oven ready, and it does work, and it's the result of a lot of research from people who've got experience of setting up alternative temporary teacher provisions locally, Ideally, a national register would be our aspirational aim, but we can start joining up the dots if we have dots locally of schools who are looking at a much more ethical way of hiring temporary staff. And now is as good a time as ever to be doing it when
Definitely.
there is the demand, and it would put a lot of people's minds at ease. It would put schools back in control of what they're doing. So I'd strongly recommend, I've linked it in the chat box, but it would strongly recommend that anybody who's in school leadership has a look at that. Anybody
Brilliant.
who's a school rep has a look at that. And anybody who's on a local union committee, and anybody who's associated with the TUC, have a good look at that, and see that it's applicable in many circumstances. This is specifically for schools, but it's something we all need to be looking at.
Yeah.
Yeah,
Yeah.
we would like it to snowball. It's a good idea whose time has come.
Excellent. So better for agency workers, for those supply workers, better deal for the schools and colleges that they work for, and ultimately a better deal for our children and young people. And for the rest of you, any final words? What should we be doing now? What should government be doing, or what can we do to put that pressure on? Claire, what would be your number one thing we should do now?
Well, the number one thing that I want to communicate as an epidemiologist is that half-assed measures when you're dealing with an infectious disease, they don't even result in half-assed results. They're really particularly ineffective, because when you're dealing with dynamic phenomena, like the way that a disease increases in an exponential way and also decreases potentially in an exponential way, then the number one thing you need to understand is that if you increase the efforts that you put in to decreasing the decreasing the incidence, you get really disproportionate gains. So what I'd like to communicate is that zero COVID is achievable, and it's achievable if we pile on lots of different interventions and turn them up to the max all at the same point in time. And that by just treating this epidemic like any other problem where the efforts you put in are proportional to the results is really getting us, well, we've seen it's got us nowhere, and we haven't seen the government change its tactics. What I'd like to happen is everything dialed up all at once. You know, I've shown that school closures are particularly effective, and if we pile that on top of several other interventions, and especially if we've got vaccination coming in, I think that's the time when vaccination's achieving, you know, getting out to quite a lot of the population. That's the time to say, right, we've had enough of this, we can finish it off. Now's the time to have a short period where we close everything and put on all the interventions and finally get rid of this epidemic forever.
Right, so a big push all at once, finish this virus off, keep our communities safe. Karam?
I think we need to be doing everything we can to challenge the false narrative of a second round of austerity. Public sector pay freeze is going to cause fiscal drag. It's going to harm economic recovery. How can we save the high street and hospitality if we destroy the disposable income of millions of public sector workers? The private sector needs customers. If we've got no money, they're going out of business as well.
Thanks, Karam. So it's about us all being together, not pitting one part of the workforce against another. And Merike, final word for today.
Lobbying campaigns so that schools can, and all educational establishments can be funded properly. We know that we're spending far much more than we usually would on cleaning supplies, tissues, hand sanitizer, hand gel, soap, paper towels, lidded bins. No money for it. And that's having a knock-on impact because we're not able to afford to hire the staff that we need in order to cover absences.
Right, so proper funding of schools and colleges now to keep schools, colleges and communities safe. Thank you all so much for joining us today. Shelagh, Claire, Karam, Merike, thanks very much. And thanks to everyone who's been listening. Please do subscribe using the button below, and we'll see you next time. Bye-bye.
Thank you.
Bye.
Bye.
Bye.